Good evening. My name is Soren Thompson. This is my speech for SPSCO 151. It's a persuasive speech. It would be on Ebola. Ebola. Should the United States restrict travel to the United States from affected countries? World governments are being pressured to ban entry to travelers from the countries affected by Ebola. The number of countries are growing, but are predominantly from Liberia, Sierra Leone, Guyana, and Mali. Ebola is growing and increasing at a rate of 5,000 to 10,000 cases per week. Statistics are showing that of the people carrying Ebola, 3 of those people are likely to fly from affected countries each month. 2/3 of the persons affected with Ebola will travel to third world countries with poor health care and setting off further outbreaks. The CDC, the Center for Disease Control, experts are unanimous in their conclusions that a ban on outward air travel from affected countries would be disastrous. 12 African countries thus far have closed their borders and initiated mandatory lockdowns of towns and cities. The public is demanding that the United States close its borders and restrict all flight from affected countries until Ebola is controlled. The government is feeling pressured by the public opinion, while the healthcare experts are insisting this would only make the problem worse and prolong cure and control of Ebola. The United States, the United Kingdom, and Canada have no restrictions but are conducting screenings. Airlines have canceled flights to affected countries and have reduced the number of seats available to 50 to 85%. Ebola is a type of disease that incubates, causing a major problem. Ebola does not cause fever for 9 to 21 days. 2/3 of the people departing would be symptom-free at the time of departure. People could lie about having been exposed or could be unaware of exposure because of the incubation period. Screening at airports is also difficult because it incubates. Existing screening is not an effective form of screening, but out of 36,000 travelers screened, 77 were stopped because they had fever. None of them tested positive for Ebola. Where does Ebola live outside of the body? Scientists are unsure of where Ebola lives when not inside of the human. A strain of Ebola lives, Marzurg virus, in a species of fruit bats. Scientists believe that an insect or tick is living on fruit bats and infecting them with Ebola. They're not sure why some people get Ebola and why some don't. Ebola outbreak and potential spreading. Ebola could infect 1.4 million people by January 2015. Doctors and healthcare workers need training in combating Ebola, but many may not make it to Africa to help because of the time of training involved. Healthcare workers are expressing a shortage of supplies as the disease grows. Healthcare workers are underreporting Ebola cases because patients are being turned away from overwhelmed hospitals. Limited healthcare workers would be able to respond to affected countries. Ebola host country elite would leave the country before a ban went into effect. Food, water, electricity capabilities could collapse, and international workers would be forced to leave because of no basic necessities. Experts are suggesting a Black Death quarantine technique. Travelers would spend time in quarantine before and after travel. This would delay travelers by weeks to avoid an infection that has only reached 0.05% of the world population. I hope you enjoyed this presentation of Ebola and why the United States should or should not close its borders.